So head and neck cancer is really kind of a broad-based term for anything above the collarbones but outside of the brain. So that includes the thyroid cancers, which are probably the most common things we see, but also what we call head and neck mucosal malignancies. These would be cancers of the tongue, the mouth, the throat, the vocal cords, things like that. We also have salivary gland tumors that we also treat, and skin cancers that occur in the head and neck region. We have been seeing increases in certain types of head and neck tumors, mainly cancers of the back of the throat or the oropharynx that are related to the human papillomavirus. For whatever reason, and the jury is really still out on this, there has been an epidemic increase in these cancers over the past decade or so. These tumors tend to respond very well to treatment, but often require multiple subspecialists to treat the tumor. And therefore, that has created a whole new paradigm in taking care of these patients. I think what the multidisciplinary clinic provides to the patient is, first, it streamlines their care. It gets them in to see all the subspecialists that they need in a single visit rather than scattered over a period of time. And I think that's very important because being diagnosed with cancer is stressful enough, and not having to worry about how long it's going to take you to be seen or to be treated will only add to that stress. Yes, there have been many new technological developments, mainly in surgical robotics, that have opened up possibility of removing these tumors surgically through the mouth in operations where the patients can even go home the next day. And many of these patients would not have been surgical candidates in the past, are now able to be treated surgically because of advances in robotics. I think the biggest misconception that patients have is that these cancers are uncurable or are going to be debilitating. And although many of the treatments that we have do have side effects, the quality of life after treatment for most of these patients is considered to be very good.